Thank you very much for coming out. As the U.S. settles into the 21st century, the lack of a national child care system is felt by millions of families every day. There's no shortage of evidence that quality child care supports children, families, and employers. However, the U.S. has lost sight of developing a coordinated system that meets parents' and children's needs. The child care arrangements of U.S. infants, toddlers, and preschoolers are really quite complex. On average, they spend about 30 hours a week in settings that range from relative or non-relative care in their own home, a family daycare home program, or a child care center, Head Start, or preschool. 30% of children have multiple child care arrangements in a given week. The economics of U.S. child care are truly wacky. Even Lester Freeman, forensic accountant extraordinaire, couldn't follow the money. Although it is extolled as a vital collective good, the absence of national standards and blended public-private financing positions child care squarely as a private family responsibility. Thus, parents are responsible for making these decisions and for monitoring the day-to-day quality of those arrangements. All things considered, there simply is not enough quality, affordable child care to go around. Before kindergarten, the average child has more than 5 different child care arrangements. Although many people are working to improve things, several deep-seated barriers threaten every step of progress. For decades, U.S. child care has suffered from a lack of common language and purpose, cultural anxiety about mothers working, and a workforce beset by low expectations and low pay. Since the 1970s, the U.S. has taken a hands-off approach to basic public health standards for child care. Instead, these rules are set at the state level, and the differences are quite monumental. In one state, a 2-year-old will experience a 1-to-4 adult-to-child ratio in child care, and in another state, that same child will experience a 1-to-8 adult-to-child ratio. We can thank Richard Nixon for this. He unexpectedly vetoed the Comprehensive Child Development Act of 1971, legislation that would have established federal standards for child care, expanded and improved services for all families, and integrated children of all races at younger ages. As for unclear language and purpose, child care is plagued by definitional ambiguity that concerns the function of non-maternal care. Is child care simply a custodial service, babysitting, daycare, or even night care, which is becoming much more common in institutions, that supports parental employment? Or is child care a necessary educational intervention, such as Head Start and state-funded pre-K programs, that contemporary economists argue will reduce the achievement gap and prevent future crime, although these programs rarely cover a parent workday or operate full year? Since the 1980s, the majority of U.S. families have relied on child care to support their employment. Today, 64% of women with children under the age of 6 are employed. However, little national progress has been made toward building a coherent system of child care. Furthermore, despite women's essential role in the civilian workforce and the household economy, cultural anxiety toward maternal employment refuses to go away. As one working mom from mid-Missouri told me, "Why, because I'm ambitious, am I automatically a bad or neglectful mom? Why can't I be both?" Even our First Lady, a Harvard-educated lawyer with bona fide working mom credentials, experiences the struggles. In 2009, she told a group of young women at Howard University, "There isn't a day that goes by that I don't wonder or worry about whether I'm doing the right thing for myself, for my family, and for my girls." In today's America, most women, especially college-educated women, experience paid employment, childbearing, and child-rearing with little interruption. Yet powerful segments of U.S. society remain committed to the belief that only full-time mother care qualifies as good mothering. Erica Jong's recent Mother Madness essay for the Wall Street Journal cautioned that such selfless investment in mothering, conceptualized as attachment parenting or intensive mothering, provides a political right with more than enough reason to limit universal supports, such as child care for working families. And indeed, child care workers in the U.S. are grossly undervalued. The door opens far too easily to employment, and the pay is terrible. Although over half of the workforce has some college credits or a degree, in 2010, the median hourly wage of child care workers was $9.28 an hour, or $19,300 annually. Coincidentally, research shows time and time again that the key ingredient of quality child care is the caregiver herself, and what predicts warm and appropriate caregiving is educational preparation, ongoing training. Unfortunately, most states require minimal pre-service education for workers in regulated child care programs. Although some programs, such as Head Start and state-funded pre-K, require that teachers have an AA or a BA, such policies benefit only select segments of the population. And so long as this continues, all child care boats are not rising together, and the child care boat is tilting. States who have increased access to childcare, quality childcare, such as North Carolina, began their efforts by tightening regulations, professionalizing the workforce, and growing public will to invest in creating an inclusive early childhood system. A former child care administrator captured it well. It's the same group of kids that we are all serving. Other states are working toward better conditions of employment, including higher wages and benefits, through organizing child care workers. 80,000 family child care providers, Head Start teachers, child care center teachers, and after-school workers are represented by the SEIU in 18 states and Puerto Rico. Imagine a day, a work day that is, when the U.S. has a national system of child care. Mothers and fathers could work without worry. Child care providers would be professionalized and well compensated, or fairly compensated, and our children and families would be well cared for. I wish I had some bad art, but it didn't apply. I couldn't find any.